Off the top tonight, healthcare turmoil for thousands in southeast Wisconsin. Ascension, Wisconsin is no longer accepting United Healthcare insurance because the two companies could not reach a deal. As of today, Ascension is now out of network for United. 12 News' Nick Bohr is live at Ascension St. Joseph Hospital in Milwaukee. And Nick, the news led to many canceled appointments and patients wondering what they should do next.
Right, Derek, if you've had Ascension healthcare providers like those here at St. Joe's and can't suddenly switch insurance, you'll have a tough decision to make about your health because neither side seems like they're budging. It's a moment of uncertainty over the most important of personal issues, your health.
When I walked in and did my whole check-in process, she's like, oh, you have United Healthcare, so it probably won't be covered and you'll have to pay out of pocket.
Tiffany Jones turned around and left her scheduled mammogram. Her experience repeated over and over at Ascension facilities around Wisconsin Wednesday after they dropped United Healthcare insurance. The two had been negotiating on a new agreement for months, but ultimately couldn't see eye to eye.
I have this rapport with my doctor. When I go see her, she asks about the family, she asks about the kids. I don't want to have to do that all over again with a new person.
United Healthcare issued a statement on the impasse, saying in part, despite repeated efforts to reach a compromise, Ascension Wisconsin has chosen to leave our network. Ascension refused our latest proposal, which would have continued to reimburse the health system at market competitive rates, and declined another request to extend our contract to allow additional time to negotiate. Jones hoped they might work something out soon because she suspects other providers like Aurora and ProHealth will be overwhelmed if everyone else is trying to reschedule exams and tests with them. Ascension tells 12 News, quote, the reimbursement rates United Healthcare proposed do not adequately account for the significant financial pressures facing healthcare providers, including unprecedented inflation and rising costs for equipment and medications.
Like, what's really important here? Is it the money or is it the patients? And that is kind of what it boils down to.
And so Nick's back live with us tonight. Nick, patients are left wondering, do they make the insurance or doctor switch now, or do they just wait to see if something can be worked out?
Right. How are patients supposed to know? And there's a lot of them. Just one example, all the city of Milwaukee, all the Milwaukee County workers all have United Healthcare. It's not clear how many of them are Ascension patients, but certainly it is a lot of them. And going forward, at least for now, any of them who choose to continue to use Ascension with United Healthcare will have to pay out of network, which of course is a lot more expensive.
Nick Bohr reporting live for us in Milwaukee.